guys, Dr. Randy, Kalkstein Family Chiropractic. Today I have Susan in the office. I want to shoot an adjustment video because we adjust her full spine and almost every extremity. So I'm going to adjust her hips, low back, mid back, neck, hips, knees, ankles, elbows, wrists, what else? So full spine adjustment. Here we go. Susan's a teacher, so she works really hard during the week. She's a lot of stress, slide down. She usually comes in towards the end of the week for her adjustment. She likes to stay active. So this helps keep her active. Feeling good. Doing some leg checks there. That helps me determine which SI joint is restricted, what way her pelvic imbalance is. In this case, she has a right extension restriction in her right SI. So the way we fix that is we just do some drop work, contact the right SI, and the ilium goes inferior and posterior. So we adjust it back in place. We have a lot of patients, by the way, and I'm going to adjust her on her side, who just get their lumbar spine adjusted face down. They may have a bad disc, an inflamed disc, a hot disc at that time, and so we won't put them on their side. Just if that's the case for you, you can still have your low back adjusted face down, just with this drop work. It's very comfortable for the patient, and still very effective without having to twist them. Just gonna recheck that better. Okay, slide down, Susan, just a bit for me. Take a nice deep breath in. Exhale, relax your shoulders. Good. Go on your side facing me. This leg straight, this leg on top. Perfect. Take a nice deep breath in. All the way out. Good. Other side, there's her low back. One side, deep breath in. Exhale, all the way out. The other side, face up. Hang on to the side of the table. Perfect, right there. Just relax your shoulders for me, Susan. Got that hand. This one. There's the ankle, moves good on that side. A little bit of hip there too as well. Okay, so far so good. Let's get up to the neck. And today your chief complaint was neck pain, headaches. We see a ton of in the office. So we're gonna pay particular attention to what's going on up here. And you can feel she's really out right here. Your shoulders. Perfect. This side. That's her upper cervical, that's her upper neck adjustment. That's going to help her with her neck pain, her headaches, all the tension that sort of builds up the base of our skull for everybody. Especially, as a teacher, head down, grading papers, a lot of reading, a lot of desk work. So all that tension can build up in these suboccipitals and the upper cervical spine. Don't take Tylenol, don't take Motrin for it. That's just masking the symptoms. Getting adjusted and getting your spine checked gets to the root cause of it, which is, for these musculoskeletal problems, is always at the level of the spine. It's vertebrae that are restricted, that are misaligned, that are irritating nearby nerves and soft tissue, causing spasm and inflammation to build up. If you leave it go and don't do anything for it, your pain may come and go, but scar tissue is going to build up in your spine. You don't want a spine full of a lot of scar tissue. It's going to lead to a bigger problem down the road. So her neck moved really well today. Now we're also going to do some traction and some cervical distraction for her neck. Pat under the knees, that keeps the low back flat. By the way, if you have a bad low back, put a pillow underneath your knees when you sleep, or if you're on your side, put a pillow in between your knees when you sleep. Pick your head up for me. Relax it all the way down. This is just cervical distraction. We use a towel to get a little extra leverage, and it's a nice light pull, nice light pressure for her. You okay there? Mm-hmm. Stay off the ears, we stay off the earrings. And that just pulls, distracts the neck. Take pressure off the intervertebral discs, especially at the lower neck. people with pain in the shoulders and pain down the arms, it's discs that are inflamed in their lower neck. This distracts, takes pressure off those discs. Feels really, really good. Good, one more. Perfect. Now her mid-back didn't move great face down, so we're gonna do it one more time, face up. And we're gonna do your extremities. Cross these arms. So far, you're doing great. Slide down towards me. We're gonna roll. We're just contacting, if you can see, I'm just contacting her thoracic spine between her shoulder blades. So all the pain people get, the tension that builds up between the shoulder blades, this adjustment's really good for that. Roll back on my hand for me. Good. Last one. I'm tight there, that's okay. Okay, come on up. All right, swing your feet over that way. So we're gonna do her shoulders, wrists, and elbows here, and then I'll do her knees. So far, so good. Okay, just relax that arm for me. Shoulder drop. Good, that's her right shoulder. That's the glenohumeral joint. It's a ball and socket joint, and because everybody's so rounded all the time, everybody's forward. 90% of my patients, that adjustment pulls that ball and socket joint back. It pulls that glenohumeral joint back where it should be. So it helps keep the shoulders back. Okay, then we'll do elbows. Just ulnar and radial head and the elbows. That feels pretty good. How are your wrists today?
The thumbs.
Lean back away a little bit. Good. Don't worry about that, Ash. Lean back away a little bit there. Good. Good thumb and wrist adjustment there. And then last but not least, her knee adjustment. So it's more of a mobilization. Just relax your knees for me. You just kind of mobilize it. Stress the lateral aspect and the medial aspect and give it a little bit of pull. Really good. We have a lot of patients with a lot of knee pain, low back and knee pain, and this adjustment, this mobilization technique is really good for that knee pain. Okay, so that's it. That's full spine adjustment, extremities. Thanks for watching.